I'm excited. We're going to cover some of the most commonly asked questions that we got from you guys on social media and YouTube comments. Hey, I'm Dr. Parsa Mohebi, a hair transplant surgeon. Today I'm going to cover some of the most interesting and common questions that you ask. We'd love to hear questions that you sent on YouTube and social media. Keep sending them on. So you ask how long a hair transplant can last, and do you need to get a hair transplant in the future? The answer has to do with your personal condition. Some people, when we see them, we have evidence of future hair loss in just a limited area of front and corners, and we look into the family pattern and we know that nobody else has lost more than that, and our microscopic evaluation doesn't show any evidence of future hair loss. So for those people, one hair transplant is usually sufficient to give them the nice and thick hairline that they need. However, a lot of people come to us early on in the process of hair loss and they're just showing the recession of the corners, but we know based on the microscopic evaluation that we do that we can predict how they're going to present themselves in the future. So for those people, we can tell them that they probably need more hair transplant or need to be on medications to minimize the need for future hair transplant. The cost of hair transplant is one of the most common questions that we get. It has to do with obviously the area of hair loss. So the more hair grafts we're implanting, the more time you need for procedure and the more costly the procedure becomes. If you have just a limited hair loss, your need is very minimal. If you have a big area to cover, you have a big number of grafts, the cost is usually calculated per number of grafts. So it could be like $8 per graft for certain procedures. For certain procedures, it could be more, like celebrity hair transplant. And if you don't want to have any hair shaven or cut on the back, you probably have to pay a little more just for not shaving. You ask us if you could be completely bald and still get a hair transplant. The answer is absolutely yes. Hair transplant can always make improvement. If you are completely bald in a sense that you're class 7 of hair loss, so you just have a rim of hair on the scalp, and even that rim of hair is not very generous, you still can remove some. We can remove some of those hairs and put them on the frontal area and create a hairline for you, or appearance of having a different pattern of hair loss. So you don't have to be class 7 with that rim of hair on the scalp. You could be class 4 with some receded hairline and some good hair on top, and again some thinning on the crown. Again, it has to do with your personal situation. Sometimes people are having just limited hair here on the back, but they have a good beard. So you can use hair from the beard and give them full head of hair. Some people don't have beard or scalp hair. We can use body hair. So there's so many different options we can use with current technologies that we have. Where your hairline should start on your face? That's a very good question, and that's the topic that I educate my patients when they come for consultations, because a lot of people come to our office like a 20-year-old man with some recession of hairline. They bring me the picture of when they were 16 and they expect the same hairline. That's not necessarily a good idea, because the kiddie hairline or juvenile hairline that you once had should not be there when you're 30, 40, 50, or 60 years of age. And hair transplant is a permanent procedure. So if I put that hairline on the spot that you had it at age 16, it will be there when you're 60 years of age and it will look ridiculous. So we don't want that. So we always want to create a mature hairline, something that looks good at age 20, 30, 40, or even 60. So that has to do with the proportions of the face. I look at the like a rule of 3, tip of the nose to chin, the same as eyebrow to hairline. That's one rule. And then the corners should go a little bit more back. That's a typical Caucasian hairline that gives you that minimally like receded in the corners, which is natural for most Caucasians. And it has to do with other facial features. When I design my hairline, I spend a good sometimes 10 to 20 minutes going back and forth and looking at the patient from different angles, make sure it looks perfect from every single angle. Downtime after hair transplant is a common question. People want to know when they can go back to work, they can go back to their normal life. A lot of people who do hair transplant in the frontal area of the scalp, they may have some visible redness between the hair or behind the hairline, and some swelling on the forehead that migrates down to the level of eyes. They usually last 3 or 4 days, the swelling does, and then it will be gone after day 5. We usually give medications to minimize that, but occasionally some people still, despite of taking medication, they still have some swelling. The redness depends on the pigments of your skin, the pigmentation of your skin. You may, if you have a very fair skin, it may last even up to a few weeks, mild pinkish discoloration. If you have a darker skin, it will be gone much quicker. So you ask us, what are the options you have for hair loss? There are plenty of options. Obviously, the first option is that you don't have to do anything. The second option, if you want to, you have some hair, you want to maintain it, you want to slow it down, you can take medications like finasteride or Rogaine, minoxidil. The surgical procedures are hair transplant procedures or like pigments, adding pigments to the scalp. Surgical procedures are having different types on their own. The older method is called FUT, that we remove a piece of the skin and harvest the grafts and put them into the balding area. The FUE method is the one that we individually extract the grafts and put them on the recipient area without having any line of a scar in the back. The more advanced methods of FUE is called celebrity hair transplant, that we do in our offices of Parsa Mohebi Hair Restoration, that we don't shave at all. People come with long hair, and they leave the office with styled hair with no evidence of procedure, basically in the donor area or very minimal on recipient area. If you take a Rogaine before procedure, you may want to continue it after procedure. It's a good idea, if that's the only hair loss medication that you take, to continue it. After 7 days from procedure, you can resume it and you can start putting it on the transplanted or around the transplanted area. That will minimize the risk of shock loss, so you won't lose hair because of the stress of healing that could happen after hair transplant. A very good question, and actually we have had a lot of time that people come with salt and pepper hair, and now the question is whether or not they want to keep a salt and pepper, they want to put it on the darker side, they want to go on the whiter side. Most people want to keep their hairline at least on the darker side, so they want to have more pigmented hair on the transplanted area, and that's naturally done if you don't do anything at all. When we extract hair, the dark hair or pigmented hair are more visible. So we are having a bias toward getting more dark hair. So usually when we do hair transplant from the back to the front, we get more dark hair on the recipient area. The other thing is, most people keep more dark hair on the back and sides of the scalp as opposed to the top. So that's another reason that we get more dark hair. So most people after hair transplant, they get a much darker hairline and they look a lot younger. Occasionally, some people want to keep it more of a blend, and then we have to discuss it, and then we have to change our strategy and intentionally try to go after the lighter hair or the whiter hair. Do we ever lose transplanted hair? If transplantation is done right, and if the hair is removed from the permanent zone that you're not supposed to lose them, the hair is supposed to follow the same quality of the donor area. Occasionally, when people go very bald and at more advanced ages, even the donor hair will decline a little bit in quality. If you have that gene, which is about like 20% of people, the transplanted hair could go through the same thing, and you may lose the value or the volume of transplanted hair. For those people, we recommend to use medications, finasteride or low-dose DHT blockers. But most people don't lose their transplanted hair, and they keep them for the rest of their lives. I hope I was able to answer your questions. If you have more questions on hair loss and hair restoration and new technologies in hair transplantation, feel free to send them to our social media or our YouTube channel. We'll love to answer your questions and keep you updated about the new technologies.